Well, hello. That didn't come out right.
Hello.
Hello, everyone. So, as we near Christmas, we wanted to talk about the 12 Days of Christmas Winter Health Tips. And this will be on our Facebook page. It's also on Instagram. And I won't get into all the details, but I want to briefly mention that it's out there and just talk a little bit about some of the tips that we're discussing. And you can look at the site, look at Facebook, and get a little more information. So what are these tips? Number one, drink water. So easily to get dehydrated. And there's a lot you can do to prevent that. And, certainly none of us drink enough water. And I see patients all the time that are
I know, getting a little
only
shriveled.
dehydrated all the time. Doc, I'm a little lightheaded. I don't feel good. There's a reason for that. Number two, dress warmly. Exposure is definitely a concern in the winter. Sometimes we don't realize how cold it is.
Yeah, or if we're out there playing like snow angels or snowball fighting and we get all wet and soggy, come in and change your clothes so you don't get any conditions from the cold weather.
And there's more specifics on all this stuff as you go through the site. Number three, sleep, always a big issue. Don't neglect the value of sleep. It's really important to your overall health, and there are things that you can do to improve your sleep, such as limiting caffeine, alcohol, and daytime napping. And the alcohol one is really interesting because people always say, well, I drink it, it helps me sleep. What happens is it induces sleep, you go to sleep, but then you wake up at 2, 3 in the morning,
Yeah,
and you
2 hours later.
you have
can't get back to sleep.
unrestorative sleep too.
And you wake up dehydrated with cotton mouth.
Right.
Ugh.
Keeping the germs away. Health tip number 4, basically this comes down to 3 things. Wash your hands, and wash your hands.
Is that what that says?
And then of course there's vaccinations and that. You can read a little more about that if you log on to Facebook or Instagram and check out what we have to say. Number 5, limit time in the cold. So just be aware of, we haven't had a lot of cold so far, which is great. We had 1 week or 2 weeks.
Yeah, a couple of days that were really cold, but we haven't. We've been pretty good so far.
But there are a number of cold hazards that we can run into. That's important.
Oh, yes. Our producer just screamed out our little pets, too.
Oh, pets. Yes.
They
Goes
for pets.
They do get cold. You got to be careful.
Yeah, especially their little feet and everything else. Yeah. So bring them in.
Yeah, my dog always goes out with a little sweater.
I won't tell you, John just rolled his eyes at me because I put the towel warmer near the door. So when the pets come in, we just warm them off with a little towel.
What's wrong with that? They get cold.
Yeah.
Number 6. I went to 4. Let's go to 6. Here we go. Dry skin. This is like a huge issue in the winter time because we all have, we have heating systems that don't moisturize the air. I have in my home, I have a hygrometer which measures the amount of humidity. It's percentage humidity. You can buy them off Amazon for $12. It's actually a really.
And what do you do with this?
It just tells you what the humidity is in your house. So in the summer, it'll be like 60%, which is great. But then in the winter, it drops down to in the 30s. And that's when you start to get the itchy, dry skin.
Yes.
So really important to moisturize.
And that's where the glasses of water will come in, too.
Water, humidification of the home, moisterization.
Don't take those nice, hot, long showers that will dry out your skin.
That gets all the oils off your skin. It actually complicates the whole dry skin issue.
Yeah.
Yep, absolutely.
Vitamin D.
Vitamin D, yeah, that's an important one because, most of us in New England are vitamin D deficient or at risk for it because we don't get enough sun exposure. Even in the summer, patients are often vitamin D deficient because, we're wearing a bunch of sunscreen, which we should do, of course. But vitamin D is basically is produced in the skin.
Yeah.
And sun exposure is a vital part of that. And, in the winter, we're all covered up. We have very little skin showing and we don't have the same ambient light anyway. And then the summertime, we're all putting on, sunscreen number 40. So, which is
keeping that
do. However, we can become very vitamin D deficient. So,
I guess
supplemental vitamin
mushrooms
D.
and salmon.
Yeah, there are foods that have vitamin D. And
okay.
You can just take some vitamin D too.
Yeah.
And that helps out also.
Yeah.
I keep going back to the wrong one.
Yeah.
There we go.
There you go.
So, yep, there we go.
Yeah.
Stay active. So it's very common in the winter time to hibernate, and human beings aren't meant to hibernate. We're not bears. So you want to basically stay really active. Make sure that if you're active in the summer, that you have a plan in the winter to also remain active. That will keep your blood pressure down. It'll keep your weight down. It will reduce anxiety. And it's going to overall improve your sleep, your mental health, your physical health.
Nice.
Yeah.
Number 9.
Supportive mental health. Here we go. We got right into it. So seasonal affective disorder is a real condition. It's from decrease in ambient light and sunshine. And many patients do become more depressed in the winter time. So there are things you can do. First of all, talk to your practitioner, your healthcare provider about that, and they can talk to you about treatments that are available. There are actually lights that you can buy them on Amazon, and they will simulate the same wavelengths as sunlight.
Really?
Yeah. And it helps out. If you're sitting at a desk all day in a cubicle and you're not getting sun exposure, you can become depressed. We clearly know that this is a real thing. People who live, in the Arctic Circle have higher incidence of depression, which can lead to alcoholism and other issues too, than those of us that are, have more sun exposure.
I had no idea that they had lights for that.
Yeah, they do. You can buy them. They're very inexpensive too.
Nice.
They do work.
Yeah.
They do work.
Good to know.
Yep. And then, along the same lines, just make sure you're connecting with other people, that you're taking breaks, that, you're just thinking about your mental health in general.
Nice.
Number 10.
Digital.
Oh, God. Yeah, this one I have to do. Well, TikTok's going off the air soon. So,
Is it?
yeah.
I wasn't sure.
So probably that will help out many of us, right?
Yeah. Yeah.
But,
Screen time.
we spend a lot of time with our devices, and it's interesting at the end of the week, if you look at your screen time, how much you actually, are on that.
Up on you.
It really does creep up.
Yeah.
So it's important to kind of break away from that and make some real human connections. Read a book, do something else, have a conversation.
Yeah.
Yeah,
Definitely.
all important stuff. And then, yes, eating. There's a lot of winter seasonal vegetables and fruits and things that maybe are more common in the winter than the summer. Try to take the opportunity to access that. And you don't want to let your diet go to pot in the winter time.
Yeah. Broccoli, carrots, and cauliflower are our friends.
All right, there we go. Excellent.
Last one.
Last one. Stay home if you're sick. So you don't want to get other people sick. There's a lot more respiratory illnesses in the winter time. We just see a lot more out there. So be aware, you don't want to get others sick. This is when we see the flu spread and, other respiratory illnesses. Now we have RSV and a whole bunch of other stuff out there. So if you are sick, avoid social gatherings.
Yeah. And sometimes that's hard, especially if you're not used to calling in sick on your job. But you have to think of, especially compromised people.
Well, I mean,
to get them sick.
It's always interesting, after like Thanksgiving or after Christmas, we'll see these outbreaks of, COVID or whatever it may be, whatever the viral illness of the week is.
Yeah.
You see a lot of it. So, try to be conscientious of that and be aware of others around you so that, you're not passing along your illness to them. So that's just a quick little summary of the 12 days of Christmas. There's a lot more information that you can get about this if you look on Facebook.
Yeah, I can access the slides.
But I just wanted to give a little brief review of what we were doing.
In your Dr. Junkus kind of way.
That's it. Yeah.
All right.
Thank you, everyone. Have a great day and a great holiday season.
Thanks.
Primacare is Southeastern New England's trusted leader in medical care. With offices in Fall River and surrounding communities, we're dedicated to your well-being. Our carefully selected team of more than 150 providers offers world-class primary and specialty medical care. Primacare doctors are supported by a skilled staff trained to deliver comprehensive radiology, imaging, and testing services. Primacare is large enough to take care of all your medical needs, but small enough to care for you personally. Primacare is by your side.